So on the right side, 3 puncture wounds, and on the left, I only saw 2 puncture wounds. But it's that left side, there's kind of that big baggy tissue, I don't know if you noticed.
Yeah.
And it looks like there's probably some air in there. There's also probably some blood and fluids and stuff. It feels fairly squishy. But as he's breathing, you can kind of see it puff out there. And it's kind of hard because he's uncomfortable. I don't want to be mean. We're getting in pain meds now, so he's comfortable. But I palpate the ribs just to make sure, you know, if I feel a fracture, where it is, etc. And I do feel on that left side, it is a bit deviated inward, like there's potentially a fracture. And then when you've got air there, there's really 2 potential scenarios where you've got air coming from the outside in, which in this case isn't likely. And the other is when it's leaking from inside out where there should be air. And that is the lungs. And potentially communication with the chest. So there's the potential that your friend has, like when the ribs broke, potentially damaged the lungs, like cut the lung with a rib or something like that. Perhaps even a tooth, if it got all the way down there and damaged it. And then you can get air from the outside getting into the chest, and then you can have air from the lungs leaking into the chest, which then subsequently leaks out of the wound and then makes the subacute tissue kind of puff up. So fundamentally speaking, he's stable. He's doing okay. You know, he's obviously painful. I don't know if you guys have ever been bitten before. The wounds are the least of your problems. It's that crushing kind of muscle damage injury that hurts really bad. And so I did 2 things for him after I looked at him. I went ahead and I put a bandage around his chest just to kind of seal up that wound if there is any communication. And it's like any fracture. You know, sometimes you just kind of wrap it a little bit snugger and bandage it and immobilize it, get some pressure on there. It makes them feel a little bit better. So I did that, shaved up the wounds, the little puncture wounds. And then we gave him a dose of methadone, which is pain medication, kind of like morphine, just to kind of make him feel better.
Yeah.
It's not going to, you know, flatten him out by any means, but just take the edge off so that we can talk and we know that he's comfortable and not back there miserable. So what the heck do we do moving forward? You know, what are kind of next steps? First thing I would probably do, take x-rays of the chest to see, are there any broken ribs? Is there air in the chest? Does it look like there's lung damage? Anything else, okay? The other thing that we can sometimes see, and it's not necessarily from the bite wound, but if they're on top of them really pushing on their belly, sometimes their diaphragm can be torn either from the pressure or from a tooth disrupting the diaphragm. And then it's kind of gross to think about, but then you got like guts that are in the chest or guts that are coming out under the skin. I don't think that's the case because usually you can feel it, at least under the skin. I can't speak for the chest. But that's a concern as well. And the chest x-rays kind of help determine, you know, are the ribs broken? If they are, do we need to do anything about it? Generally speaking, you got a communicating wound. You do, and I'll talk to you more about that. Looking for guts, make sure they're in the right place, make sure the lungs are okay, et cetera, et cetera. It's kind of a nice screening tool. The other thing that we're looking for is what's called serosal detail. I don't see any puncture wounds over the abdomen. They all appear that they're over the chest. And sometimes that line is a little bit blurred when you get by those last ribs because the diaphragm kind of sits under. So sometimes you can get tricked and it's actually communicating with the diaphragm. But they seem far enough up under the armpits that I think it really is limited to the chest. So that would be a good first step. Make sure we don't see any evidence of fluid in the abdomen, look at the ribs, look at the lungs, et cetera, et cetera. Everything else looks pretty good. You know, he's walking around okay. He's even given this, he's breathing pretty comfortably, and he's, big picture, he's stable and he's doing okay.
Great.
And now he's more comfortable because of the pain meds.
Yeah.
So, based on the x-rays, and right, everything that we do, we're doing with a goal in mind, or a direction of treatment, okay? So you don't really want to put the cart in front of the horse, but you also want to know what you're working toward, okay? And so I would do blood work, because it's just good to know where we're at as a baseline. Do the x-rays of his chest and belly, make sure everything's okay, and then go from there. It appears, given the puncture wounds here in the air and the tissue and everything else, if you've heard the old adage, it's like the tip of the iceberg. I can't tell you the number of times I've seen 2 small little puncture wounds like he has, and then I open the skin and the muscles and ribs and everything are completely shredded and pulled apart. And on the outside, it looks like, oh, that's nothing. And then you make your incision and go, oh my goodness, this is something big. And so given the kind of the defect that's present and the swelling and everything else, I'm guessing that there is something bigger, significantly bigger underlying. And we need to figure out what that is so that we can make it better. Generally speaking, if we have a penetrating chest wound, which essentially this is what this appears to be, you generally speaking, in most circumstances, you want to explore it. And what that means is taking him to surgery and making an incision behind his shoulder blade, kind of right where that big swelling is. Make an incision over that, cleaning it out, flushing it really well, and looking at his ribs, looking at his thoracic wall. And if it is torn up and beat up, basically, it's not fancy. You're just taking that torn muscle in the ribs and you're just kind of putting them back together to get that seal again, to get that negative pressure in the chest so that his lungs can work like they're supposed to. The ribs, we don't repair the rib fractures, but just by stabilizing that muscle and kind of bringing it together, makes them more comfortable. Like I said, lungs work better, more comfortable, and you regain that negative pressure, which it should be, and you also prevent what's on the outside from getting in, like infection and that sort of thing. Now, with that being said, going down that route where doing the chest x-rays, the old, and of the chest and the abdomen, doing the blood work, and then exploring that area, I think probably really is the best way to go to figure out what's going on. That's not inexpensive. And so, I'll get occasionally, what if we don't do this?
No, we'll do it. How much is that?
I'll get you an estimate together, but you're probably in the $5,000 to $6,000 range.
Oh my God.
To do that.
Jesus.
And so, and I'll give you an itemized estimate so you know for sure, but they have to be on a ventilator to help them breathe. A lot of times after surgery, they have to recover in oxygen and that sort of thing. And it's, it's a big deal. Have I done surgery on these dogs and they do great? Absolutely. If you can get them through anesthesia and get the chest wall put back together, they can do really well and go on to live happily ever after. But, my job, I have to walk that fine line, right? Like, I can't be too cavalier and paint too rosy of a picture because bad things happen, especially when you've had such bad trauma. But I don't want to be gloom and doom because I've seen a ton of these dogs that have surgery and they do great. And so I got to walk that fine line and say, if you took money, everything else out of it, and you said, what's kind of in the best interest of my pup and what am I looking at, I would say that exploring that whole, addressing what's there, getting it all put together is the way to go, and I would expect that he would do just fine based on what I know. Certainly he could open up and see something you're not necessarily expecting, but based on what I know, I would see that he would do okay. And I wouldn't have too many reservations about that, knowing that stuff happens, complications happen, but I think it's a very reasonable thing to move forward with. Now, that being said, I understand it's a lot of money.
Yeah.
And so the other approach that we can take is kind of more treating it like a wound, treating it like an open wound. I have done this on a handful of occasions, and I've had some not go well, and they ended up having to be euthanized or passed away because they couldn't breathe well. But in this case, he's already breathing far better and is far more comfortable than any of those dogs. And so I'm a little bit optimistic there. And then I've had some that go on to heal me just fine, you know, because of financial reasons or whatever. And it's just one of those things, right? Like, there's a lot of different ways to approach many different things, and some ways are better than others, but at the end of the day, you can only do what you can do. And if I thought that it was completely unreasonable to try the conservative route, I'd tell you, I'd say this is not going to work. Like I said, I think the best thing for him is the x-rays, the blood work, exploring that wound, repairing the thoracic wall, potentially placing a drain in his chest so I can remove any fluid that accumulates, air, etc. post-operatively. He stays here for 36 to 48 hours. We pull the drain, we manage his discomfort, and we get him home. Maybe he needs to be in the oxygen cage. That would kind of be ideal if we could do that approach. If we can't do that, then what I would do is I would treat him for pain and discomfort, and I would leave it bandaged to provide support and comfort and keep any air from leaking. And those little puncture wounds will seal pretty quickly. And then what will happen is where the muscle is torn, if there is any in the bone, etc., the bone will heal, and then that muscle will kind of scar, and he'll just have a dent, a defect there, but it could heal up just fine.
Is there any way that we can do the x-rays and then
See what
kind
we
of
got.
see where you're
Yeah,
at after that?
that's a great thing to do, because if we took the x-rays and we saw intestine that it was up under the skin, well, that's,
Yeah,
we have to do something about that. There's no ifs, ands, or
Yeah.
buts about it. But if it looks like it is just air and blood and inflamed tissue, then, you know, potentially doing the conservative route is something we can try, and that would be fine too.
does that sound good? I'm gonna go do the x-rays and then see.
See what we got? Okay. And he is being such a good boy. I don't think we're gonna need sedation or anything like that, and the methadone will help a little bit with that. So,
Alright.
the little
It's
bandage
gonna be
that
okay.
the little bandage I just placed, I'll just cut it off, because I'll mess with the x-ray. Take an x-ray, then I'll pop another one back on,
Okay.
and we'll see what we got
Alright.
and where we're at.
Sounds
And then
good.
he'll need to be on pain meds and antibiotics if we go the conservative route. He'll be on that for a while. And I would probably still recommend that we at least medical board him overnight, just to keep tabs on him, unless you guys feel like, you know, you can really keep
it's
a
fine.
close
Yeah,
eye.
no. I mean, we could, but I have husky puppy at home too. And
Yeah,
Robustious is the
yeah,
name of the game.
yeah. And again, just like surgery, not surgery, we